Hello, welcome to the Spiritual Regression Show with Rena on moretalk.tv. My name is Rena, and I am the Director of Divine Aspect, a therapy practice based in Dorset, UK, focusing on life coaching, regression therapy, life between life therapy, and hypnotherapy. I am here today with one of the pioneers of regression therapy in the modern world, Andy Tomlinson. Andy is the director of the Past Life Regression Academy, training regression therapists in Europe, Asia, Africa, Australia, and now in the US. Andy is also the author of 2 books in regression therapy, Healing the Eternal Soul and Exploring the Eternal Soul. We are also joined today by Dr. Peter Mack. Dr. Mack is a senior surgeon working in a public hospital in Singapore for the past 3.5 decades. He's a general surgeon by training, and he also practices regression therapy in the hospital for some selected patients who have unexplained medical symptoms. He also works with some others who go to him for emotional help. Hello, Dr. Mack and Andy, and welcome to the show. So, Dr. Mack, I'm curious, what drew you to regression therapy?
Okay, I used to love hypnosis even when I was a medical student, but I've never had a chance to learn it until several decades later when I'm about to retire. So after I've learned my hypnosis technique, I thought the next logical step will be to go on to something which is closer to my heart, and that's past lives. Because hypnosis is a kind of a stepping stone to past lives. And when I get into this past life regression, I realize it's a wonderful tool for healing. And when I use it on patients with medical problems, unexplained medical symptoms, it works wonderfully. And that was how I was drawn to it.
Wow. And you did your past life regression training with the Past Life Regression Academy. So what drew you to the academy?
Nothing. I was just looking for a training, a place for training, and I just searched the web. I found one in Singapore, and I just applied for it, and I just went for it.
Right. So Andy, as the Director of Training for the Past Life Academy, are you seeing an influx of doctors and other medical professionals attending the trainings?
And there's starting to be more people from the medical profession applying now. When I first started to do training over 10 years ago, there were really very few people that were practicing, and greater numbers are starting to come in. But it's still very much down to the culture of the country. I mean, for example, a colleague of mine who teaches medical professionals in India is finding that large numbers are attending this sort of training because of the cultural acceptance of this sort of work. In the West, it's a little less embracing for the medical world.
Right. And why do you think that more and more people are attending these sorts of trainings?
I think it's a growing realization that as wonderful as it is in terms of some of the advances of modern medicine, it's not really addressing the cause of illnesses, and often it just reduces the symptoms, particularly when pharmaceuticals are used. And I think there's a growing awareness of really wanting to explore further into this whole area of alternative ways and complementary ways of working with patients' health.
Right. So coming back to you, Dr. Peter Mack, you did say that you have used regression therapy on unexplainable medical symptoms with some patients. I was just wondering if you could give us some examples of cases that you've worked on.
Okay, I think regression therapy works very well in patients with phobias, migraines, things like irritable bowel syndromes, all kinds of chronic pain syndromes which have got no explanation, like fibromyalgia, phantom pain syndromes, etc. I think the more unexplainable the symptom is, the more likely it will work with regression therapy.
Right. Have you worked with phantom pain or any specific example that maybe you can share with us?
Well, I have had one patient before. I think this lady works in a hawker center, and she was wearing her gloves when she was operating the sugar cane juice machine, and the whole hand was caught in the roller because of the glove. And as a result, I think 2 of her fingers were crushed, turned gangrenous, and was beyond salvage. So the surgeons had to amputate her index and the middle finger, and she was in great grief and pain after that. I think after the surgery, even after the wound has healed, she continued to feel as though her fingers were still present and in a painful state. And it took me only 3 to 4 sessions to lower the pain threshold to a level where she could accept and happily went home.
Wow.
So that was my experience with phantom limb pain.
Wow. Have you worked on any cases of migraine that maybe you could share with us?
Yes, a couple. I've had one lady who had migraine for about 22 years, and she carries a tablet with her in a handbag because she needs almost invariably 1 tablet a day. She came to me, I think, some years ago because I think she had lots of problems in her childhood, child abuse from her parents, etc. And after, I think, about 2 to 3 sessions of regression therapy with her, I think she had not taken the tablet for a period of 6 weeks, and she didn't realize that. So that was the most remarkable case that I have had.
Wow. In your professional medical opinion, why do you think that regression therapy is such an effective form of healing?
Well, in medicine, we attribute all causes of diseases and symptoms to the physical level. I think we don't go beyond the physical level. Anything that's emotional or mental or spiritual, I think, is kind of regarded as being not credible or not acceptable as far as medical thinking is concerned. Now, in conditions like migraine, phantom limb, I believe all these situations, the real cause of the pain is not in the physical plane, but it lies in the emotional and the mental plane. And therefore, when we work on these people with regression therapy, we are more likely to address the root cause of the symptoms rather than just addressing the pain using medication.
Right. That's very fascinating. I also understand that, Dr. Mack, that you are practicing regression therapy within the hospital environment in Singapore. I was just curious to know, what's the response you're getting from patients?
Well, the response from my patients are almost entirely from without the hospital. I think members of the public will contact me directly, and I'll treat them in the hospital clinic and discharge them after that. I seldom, if at all, get referrals from my medical colleagues, and very seldom do I get any inpatient referrals. Most of them are self-referred.
Right. So what do you think is stopping the other medical professionals from referring patients to you?
I don't think anything is stopping them. It's just that they are a bit cynical with something which they consider as scientifically unproven. I think that's the fundamental thing behind it.
Right. Okay. And talking about other alternate forms of healing, for example, like meditation and Reiki under the guise of touch therapy, these alternate forms of healing are accepted by the medical world across the world. Do you think that regression therapy has the clout to be accepted? And if you do think so, what do you think needs to be done?
Well, at the moment in Singapore, I think meditation is gaining acceptance at quite a rapid rate, but not Reiki as yet. I think in the eyes of Singaporeans, Reiki falls into the realm of superstition, etc. As for regression therapy, I think the potential for it to be accepted by the medical profession is when we apply it to medical symptoms. That's what I believe. And to be able to get it to be better accepted by the medical profession, I think we should not work alone. I think we need a group of doctors who are convinced that the therapy will work, and we have to speak together as a united voice before our colleagues are more likely to accept it.
Right. So, Andy, what do you think about this? How do you think we can get regression therapy accepted by the medical world?
Well, it's for exactly the reasons that Peter's talked about. It calls for great bravery to talk about something radically different in the medical world, particularly something that has a spiritual nature with it. I mean, for example, we've seen how Brian Weiss, who was a psychiatrist who wrote an amazing book about the healing that his client had that had experienced past lives, and he was told to either stop working with past lives or to leave his job. So he left his job, and of course his book has sold millions of copies and touched so many people from around the world. So when people work independently, it's really hard for the work to be treated seriously by the medical world. And this is why it's so important to bring together all of the people that want to have an alternative approach that can still work with all of the wonderful medical advances that have been made, but just take it further. And it's for this reason that a society has been created called the Society for Medical Advance and Research with Regression Therapy to bring together lots of medical doctors who use regression therapy that want to speak with a united voice.
This society sounds really interesting, and what I thought we could do is maybe talk about it after the break. But before the break, Dr. Mack, I just wanted to ask you, you're obviously getting positive responses from your patients when you do this work with them within the medical system. Do they not go and talk to other medical doctors or other people who would be curious enough to come and see you to help them with their own symptoms?
Well, some of them did talk to their own doctors, and the responses are kind of a mixed. Majority are cynical about it, but there are a few who are open to it and will encourage the patients to continue the therapy with me. So I do see some encouraging developments as far as this mode of transmission of information is concerned. So
Right.
I believe there's hope.
Okay. So what are some of these encouraging developments?
Like, for instance, I think recently I have a patient who calls me up for an appointment, and she told me that her doctor has actually recommended her to see me because her doctor has read my book, has read one of my books on past lives, and believes that I may be the person who is able to help her. But this is one of the very few examples that I've come across.
Right. You have written 2 books talking about your books. One is called Healing the Deep Hurt Within, and the other one is called Life-Changing Moments in Inner Healing. Could you tell us a little bit about your books?
Okay, the first book, Healing Deep Hurt Within, is about one patient of mine. I think she presented with a problem of syncope, unexplained fainting spells for the past 1 year. And one day she fainted at the office of the director of the National Eye Center in Singapore. And because of that, I think she was brought through the emergency department into the inpatient wards of the hospital. And from there, I think the nursing officer called me for help because the doctors in the wards have literally nothing to offer her and wanted to send her home without any further treatment. So that was how I got in touch with her. And when I started speaking to her, she told me a whole host of emotional problems about her marriage, the way she was abused by the husband. She had 3 abortions, and she was being abandoned by all of her close friends because her closest friend has an affair with the husband, and she got so upset with the whole affair that she started forgetting about this inner group of her friends, and then she started having this amnesia, and it got more and more serious, and then she started fainting more and more frequently. And there was where I felt that I think regression therapy may be useful for her. So I started treating her, and it was over a period of 18 days, and I did about 8 sessions of therapy on her, and she progressed tremendously. And at the end of the 18th day, she had a dramatic recovery, and overnight she became a changed person, and she recovered completely from all her symptoms, and she was able to sleep well. She was stopped fainting. She was smiling at everybody, and she recovered, and she told me that she wanted to discontinue the treatment and asked me to write up her story for her, and that's how the first book came about.
Wow, that's really fascinating. And maybe after the break, we can talk about your second book, and then, Andy, we can talk more about SMART as well. So we'll see you right after the break.
The Past Life Regression Academy teaches hypnosis, past life regression, regression therapy, and life between lives regression internationally. Hundreds of students have been through the Academy training program and have successful practices. This is because of the amazing results they get and the referrals that come from it. For more information, see the Regression Academy website.
Hello, welcome back to the show. We're still joined by Andy Tomlinson and Dr. Peter Mack, who is a practicing surgeon in Singapore. So, Dr. Mack, we stopped off with the last segment where you were talking about your second book. So could you tell us a little bit more about your second book, Life-Changing Moments in Inner Healing?
The second book is really about 4 patient stories about past life therapy. I think the first story is about a patient who has been having visions of a lady in his mind for a long time, for many years. He doesn't know who she is because she doesn't talk to him, but he keeps seeing her face at the window and he can't explain it and was very anxious about it. And on top of it, he has got a host of other symptoms, including a phobia for water. For instance, he just cannot shower his head with water. Whenever he goes to the shower, he will shower below the neck, things of that nature. So one day, he heard me at a talk in a Buddhist temple, and after the talk, he decides to approach me for help. And when I spoke to him and he gave me the story, I realized that it was definitely a past life problem. So when I regressed him, he went back to the time of the Japanese occupation in Singapore, where this lady whom he has been seeing happens to be his fiancée in his past life. I think they were together, but before they could get married, I think the fiancé was taken away by the Japanese soldiers, raped, killed, and died in a hospital. And during the period when the lady was being taken away, he vowed to save her. He joined the guerrilla against the Japanese soldiers, but he never really could save her because a whole host of other reasons. And as a result, he felt very guilty about it. And when he eventually was caught by the Japanese soldiers, he was being dunked underwater, and that is how he developed his phobia for water. And eventually, I think he was being driven to the Punggol Point in Singapore. He was shot dead, and that was how he lost his life.
Wow.
And when he heard the story about his past life, he understood why he has a hole in the heart in his life, because that was exactly the spot where he was shot by the Japanese soldiers. Wow. That's the first story. Right. I think there are 3 other stories in it.
Right.
But this is the most dramatic one.
Okay. Well, that's really fascinating. So for people who want to read the other 3 stories and your other book, your first book, how can they purchase the books?
I think in Singapore, the book is on sale in Kinokuniya. Alternatively, they can purchase it from Brahm Center, because Brahm Center has brought in the books for its own society members.
Okay. What about international viewers? Can they get it from Amazon?
Internationally, they can get it from Amazon.com, BarnesandNobles.com, BookDepository.com, and a few other online bookstores.
Okay, brilliant. And just one other question, Dr. Mack, before we talk about SMART. You did mention that you were giving a talk at the Buddhist temple. I was wondering if any of your patients are affected by religious beliefs as to whether or not they come for sessions.
As a rule, I ask the patient about their religious background before I take up their case.
Right.
So if they've got any objections against past life, reincarnation kind of a belief systems and all that, I would tend not to take them on.
Okay. Andy, I just want to throw this question to you. Do people's religious beliefs affect the effectiveness of the healing of regression therapy?
In my experience, it makes no difference at all. I think the area where the therapist has to be quite careful is how they explain this story that emerges from the client quite spontaneously of the past life. If someone is a believer of reincarnation, then often they're very interested in going into past lives because they've probably read about how powerful it is to bring about healing. For people that have got a more materialistic view of life, then it's just simply explained as a metaphor, as a story that emerges in the same way that we have dreams. and that the therapist isn't trying to prove or disprove the reality of the experience. It's simply by working with the emerging information, it allows the healing from within the person to have an effect. And this is the skill of the therapist. So it's the expectation setting that is the most important, rather than how effective the therapy is, whatever people's religious beliefs are.
But I'm just wondering whether the perception of the importance of people's religious beliefs towards this therapy may also be a contributing factor to the challenges of getting it accepted within the medical world. Is that right, or?
I would certainly agree with that. And I gave the example before of Brian Weiss and how he was told either stop doing past life work or stop doing your job as a psychiatrist. And now that is extreme, and times have moved on since then, because that's probably 10 or 15 years ago that it happened, but it still calls for great bravery. I fully admire Peter for his stand in being able to speak his truth by saying, look, these are the patients I've treated and the amazing, almost miraculous healings that they've had where traditional therapy doesn't work. And the more medical people that are prepared to say that and to do that work, then the more it'll start to change the people within the medical world. I mean, Peter will probably be able to explain why the medical profession particularly have a lot of trouble taking on board any sort of therapy that's got a spiritual or a holistic nature.
Peter, do you want to answer that?
Yes, I think there are two sides to it. I think in the first place, our psychiatrist in Singapore, for instance, believes that hypnosis or any form of hypnotherapy by right should belong to the psychiatric domain, and anyone who is not a psychiatrist should not be performing hypnosis. I think that's fundamental to them and to the beliefs. So for somebody who is a non-psychiatrist performing hypnotherapy, I think it is already a kind of a thorn in the flesh to begin with. The second thing about past life therapy, which I recently understood from one of my psychiatric colleagues, is that they think that it is of two reasons and origin. Because they think that if it is something that is real and believable, it should be about a few hundred or 1,000 years old. It shouldn't be something that's only about 40, 50 years old. So if it's something as recent as that, then there's a lot of grounds for them to doubt whether past life therapy is something that is real and that they should believe in.
Right. So I think I'm going to bring this interview around to the Society of Medical Advancement and Research in Regression Therapy, where I understand, Andy, you're bringing together doctors from around the world to stand together, stand united to talk about the effectiveness of regression therapy. The first thing I'd like to ask is, do you agree with this doctor who says that this form of therapy is only 40 or 50 years old? Because from my understanding, in India, this actually has been used for hundreds of years, not in the model that that Dr. Brian Weiss or most of you teach at this time, but in a completely different way. They've been using past life regression therapy as a form of healing.
Well, I agree. I mean, the proof is in the amazing results that happen with clients. It's a question of, do we have to do nothing for a few hundred years before we start treating people? When we bring out new medication, we don't wait hundreds of years before we use it. There's a crying demand from people to have the new medication. And, in the same way with a therapy that doesn't have all the side effects of medication, there's a tremendous demand for it. And in fact, this is probably the reason why so many people are now being trained in past life and regression therapy, is because of the demand from the public. The question is whether the medical profession are going to keep up with that demand or allow non-medical people to fill the gap.
Right. So let's then talk about the Society of Medical Advancement and Research in Regression Therapy then. Can you tell us more about it? How did the idea come about? What are the visions and goals of SMART?
Well, it's quite simply that we do have this awareness that in the medical world, there is this demand for more and more evidence before something new is introduced. And that's very understandable for it to be the case. And with the growing number of medical doctors who are now using regression therapy, the idea was to bring them all together, or certainly those that are interested in being involved with medical research, and forming a society where collectively they can pool their expertise and knowledge and collectively bring about a bigger influence in the medical world. It's a little bit like the analogy of a bunch of sticks. You know, if you take an individual stick, it's very easy to snap it. But when you put a whole set of sticks together and try to break them, it's incredibly strong. So the society was created in April 2013 in Porto and brought together 14 medical doctors from around the world, from Germany, from Portugal, from Brazil, and Peter joined it from Singapore as well. So it's a truly international group, and they got together to decide how they could collectively work together. And the vision that they have is to have research using regression therapy that's led by medical doctors who want to bring in complementary and holistic approaches into medicine. And their plans to do that is to conduct medical research with regression therapy, to increase the awareness of this sort of work as a healing tool, and to promote regression therapy not only to the medical profession but to the wider public.
Right. Could you tell us a bit about some of the research projects that SMART has undertaken?
Well, there's two initial areas that the medical doctors are looking at. One of them is research with unexplainable chronic pain. This is for people that have got a pain where there's no obvious medical explanation, and using regression therapy with that, because quite often, although there may not be a physical explanation for the pain, there's normally some other explanation, and quite often an emotional one, at the root of it. And this is what regression therapy is particularly good at, is going to the very source of the problem and resolving it. So there's a research project now that's been done in both Germany, Portugal, and Brazil that's putting together clinical trials of looking at the effectivity of regression therapy with that particular problem. There's also a team in Italy that want to go ahead and use MRI scans while people are experiencing past life regression, and to look at the changes of the brain before and after therapy, and particularly the changes that occur that can be seen that correspond with the the benefit the client has. And the area they're particularly interested in is social phobia, because it's been found in the past that it's quite possible, it's quite, through the MRI scan, it's possible to see physical changes of the brain which would cooperate with the reports of how the problem has been resolved from the clients. So that's a really interesting area of research that the team in Italy want to work with.
And the MRI will actually track physiological changes as a result of regression therapy.
Yeah, absolutely. So not only do you get the report of clients saying the emotional problem has been resolved, but you're able to see a physical change to the brain as well, which I think is really important in the medical world because of its high focus on the physical body.
That's really fascinating. We will continue this conversation right after the break with Dr. Mack and Andy Tomlinson.
The Past Life Regression Academy teaches hypnosis, past life regression, regression therapy, and life between lives regression internationally. Hundreds of students have been through the Academy training program and have successful practices. This is because of the amazing results they get and the referrals that come from it. For more information, see the Regression Academy website.
Hello, welcome back to the show. We're still joined by Andy Tomlinson and Dr. Peter Mack, and we were just talking about SMART and some of the research projects that SMART has been undertaking thus far. And I just wanted to ask you as well, what other achievements have SMART had recently?
Well, I think the new book that the members are producing is probably something that is worth talking about. I'll pass that through to Peter because he's been really organizing it and editing the book.
So Peter, what is the title of this new book?
Right, the title has been collectively agreed by all the members as Inner Healing Journey hyphen a medical perspective.
Right. Can you tell us a bit about the contents of this book?
Right. The contents of this book is mainly, I think, story-based, stories of individual patients that the various authors have treated in their own practice. I think all in their 11 patient stories, contributed by 6 authors, including myself, two from Brazil, one from Germany, myself from Singapore, and 2 from India.
Right.
Yeah.
India. Could you tell us, maybe share with us a few of the stories?
Right. My own story is about a lady who's in her 40s and have a marriage crisis, and she was breaking down because of the bad news that the husband's going to divorce her, and she come and seek help from me. And after the course of regression therapy, I think she got over it and became cheerful and started to move on in life. And at the end, even though she's still separated from the husband, she was able to live a perfectly normal and fruitful and productive life and stay happy. That was my story. Now, there are other several stories that the co-authors have contributed. There are stories on self-love and self-destruction. There's a story on inner child healing. There are stories on chronic pain from my friend in Brazil. There is a story on intractable asthma. There's a story on autoimmune disorder, etc., etc. I think there are many of them.
I'm just curious because, obviously it's a collective of stories from different doctors from all over the world. So it's basically an international collection of regression therapy cases. I'm just wondering whether cultural beliefs or religious beliefs actually have an added effect to some of these cases. Because you did say there were a couple from India, a couple from Brazil.
Okay, as far as I know from my Brazilian friends, Brazil is predominantly a Christian country, but apparently they don't have that much of a problem about reincarnation because they have this spiritism which teaches about reincarnation, and the people do believe in them. So according to them, I think the problem is really not much in Brazil. I think in Singapore, it's a different situation because Asian culture is such that most of us accept reincarnation as a way of life, not so much as a religion per se. And therefore, when we talk about past lives, people don't object violently to it as such. It's just that maybe if it goes against the belief system, then they may not come for the therapy. But otherwise, they are not violent about their objections to it. In India, I suppose it's much less of a problem because I think reincarnation aligns very well with Buddhism and Hinduism. So I believe the potential for developing regression therapy will probably be greatest in India, from my point of view.
Andy, would you like to add anything to that?
Well, only that in countries where it's culturally more acceptable to move ahead with this sort of work, the changes are so much quicker. I mean, for example, a colleague of mine, or one of the members of the society, Dr. Newton and his wife, Dr. Lashmia, have got a program to get regression therapists into all of the hospitals in India, and they are rapidly training a lot of medical professionals there. So where it's culturally accepted, it's possible to move a lot quicker. In other cultures which are less open to it, then progress will just be a little slower.
Got it. Okay. And with regards to this book, this new book, Inner Healing Journey, a medical perspective, when can we purchase it or buy it? When will it be available, and how can viewers purchase it or buy it?
Okay, perhaps if I can take that. I've just read the first draft of it that Peter has put together, and I need to say, on all of Peter's books, they are fascinating reads. I get people who comment and say things like, as soon as I started reading the book, I couldn't put it down. It's that absorbing. And this third book is equally the same. Peter has been able to install his gift for telling stories into the other contributors. So it's going to be a really great read for readers. As not only that, but to demonstrate just how powerful this work is with a range of emotional and medical problems. It will be available in all the internet providers, certainly the big ones like Amazon and so on. It's due to be available at the very latest by October this year, I suspect it will probably be orderable a month or so earlier.
Okay. Will it also be available for purchase on the SMART website?
There'll be a link on the SMART website on how to order it. So we'll be doing links to different websites from different parts of the world. I mean, for example, the Amazon.com service parts of the US and parts of Asia, whereas some of the other Amazon sites service parts of Europe better. So we'll certainly organize it so wherever people are around the world, they can order the book. And a lot of these internet companies ship them for free anyway. So it's possible for them to get the book within a few days.
Okay. So this book is basically going to promote regression therapy that's been used in the medical world to the general wider public. The two research projects you were talking about with chronic pain and MRI scanning, how will those be promoted to the public? The results of that research, how will those be promoted to the public?
Well, in my view, I think the public are much more interested in the book, and because this is a really quick way to get an appreciation of how medical professionals are using this sort of approach and the amazing conditions that are being healed and resolved. I think as far as the medical profession is concerned, then although the book will be helpful for that, slightly more traditional research is needed. And this is where the chronic pain research would be the first area to start with. But there's going to be a need for research into other types of problem. And the more of this that is produced and the more of it that's published in medical magazines like The Lancet and so on, then the more we'll start to change the perception of this sort of work. And you mentioned earlier, Rena, about how meditation now is being accepted by most of the hospitals. Well, 5 or 10 years ago, it wasn't. And as more and more research has been done, as more and more people have discovered how powerful this is, they haven't waited 100 or 200 years before it's been incorporated. They've done it right away. And they've found that it's actually enhancing people's lives enormously. And I think the same thing will happen with regression therapy too.
Right. And you also mentioned with SMART, there are currently 14 members. What's your criteria of membership into SMART?
Well, it's predominantly an association for medical professionals. There are now 20 medical professionals in that and 5 psychologists. It's really open for any medical doctor that wants to be involved with research using this particular type of healing. They can either be trained in regression therapy themselves first and conduct their own research, or they can work with teams of regression therapists and check the results before and after and be prepared to pull the information together so that it can be published in the appropriate forms of dissemination of medical knowledge to the medical profession.
Right. And if there are other medical professionals who are watching, who are interested and would like to be part of SMART, how do they go about doing that?
Oh, well, please go through onto the website, and there's a place there where you can actually apply. And or if you have any difficulty of any sort, then for the time being, you can contact myself. The email address is regressionacademy@gmail.com. That's Regression Academy, all one word. Or they can go on to the SMART website, and that's www.smar-rt smart.com.
And Dr. Mack, just coming back to you, you are a founding member of SMART. Could you just share with us how being a member of SMART has been advantageous for you?
Well, the first thing I spoke to a fellow member of SMART during our meeting in Porto last year was that I no longer have to fight the battle alone, because it's very tiring to fight your own medical colleagues and try to back up regression therapy to them single-handedly. Now at least we have got an organization, we got fellow members to back each other up. It is much easier to gain credibility and backing in the truth of what you say and the results that you're getting. I think that's the main advantage of being a member.
Do you also talk about how different techniques can help with different medical conditions, or how, just basically share about how we can help clients a little bit better? Does SMART provide a platform for you to have these open discussions and debates as well?
Well, yes. I think for a start, the book which I have edited and contributed, from the stories themselves, we learn from one another the different kind of techniques or modification of techniques that they are using for different conditions, different situations, and how do they handle different responses. I think all these are very useful information that we are indirectly sharing through the book, which we have collectively contributed.
Yes, and of course this will enhance the actual practice of regression therapy as well by all the members who are involved.
Absolutely.
Yeah.
And I think this is an advantage of how this is a slightly different way of how research can be done, rather than the very traditional trial-based, where people just get statistics at the end of the day. With this, it's much more meaningful because people can read about it, other professionals can learn from how other professionals are working. And I think there's a need to be much more flexible in the medical world, how research is accepted. When we have a whole group of people, and now we have 20 medical professionals that are working with past life and regression therapy, and all of them are doing the work in a very honest and with a full integrity of approach, then their stories and their approaches need to be listened to. And I think that as more and more people do that, and as more and more medical professionals are trained in this sort of work and start using it themselves, it's a snowball. It'll get bigger and it will grow faster simply by the proof of the results that come from it.
Absolutely.
You're absolutely right.
And I think of almost all the stories that I've included in the book, I think the results are absolutely amazing, transformational, and I would say very dramatic, to the point of being miraculous in nature.
Well, we look forward to the book coming out then. Just very quickly, just to close the show, we just want to know, Andy, what sort of challenges has SMART actually got at the moment that you would like to ask viewers for help with?
Well, there's two areas. I mean, some of the research that we do, such as producing the book that we've been talking about, and the chronic pain research, are being done through the members volunteering their time for free.
Right.
But with some of the research that we need to do, particularly with MRI scans, then we have to hire quite expensive equipment. So there is some funding that's required for that work. So if anybody has got access to funding that could help us, we'd certainly appreciate, and we can put together a full proposal to go with the funding that comes from that. I think the other area, more for the general public, is just to pass the message on to their colleagues. As we give recommendations to others, perhaps any of the books that Peter's been talking about. If any of the public read them and like them, then tell their friends about it, tell their colleagues. And this is part of spreading the message.
So basically, it's about funding and also spreading the message.
Yes, I think these are two.
Thank you so much, Andy Tomlinson and Dr. Peter Mack, for participating in the show today. It's been absolutely fascinating.
Thank you, Rena.
Thank you, Rena.
That's all the time we have for this show. Thank you, everyone, for tuning in. For more information on Dr. Peter Mack, please visit petermack.sg. For more information on Andy Tomlinson and the Past Life Regression Academy, please visit regressionacademy.com. For more information on SMART, please visit SMART, SMAR-RT.com. For more information on me, please visit divineaspect.com. Until next time, thank you for joining us.
The Past Life Regression Academy teaches hypnosis, past life regression, regression therapy, and life between lives regression internationally. Hundreds of students have been through the Academy training program and have successful practices. This is because of the amazing results they get and the referrals that come from it. For more information, see the Regression Academy website